I'm curious to hear what you've seen with regards to substance use and addictions with some of your employer clients, and how this really has shifted some of their focuses as well.
Well, I mean, just the stats alone, I think, are speak for themselves. But we've seen a lot of, I look at mental health, substance abuse kind of all in the same umbrella.
Hmm.
And we've seen employers really try to communicate, hey, we've got this EAP, why don't you use it? But we're really not seeing the engagement that you would think after the employers are communicating that. It could be because people are just entering survival mode, right? They just don't know what to do, aren't ready to seek out that immediate support. We're also seeing, that shift from that in-person to trying to have that virtual care. And some providers just weren't able to pivot that quickly. So we have an access to care issue. So even though somebody might want help and need help, they may not be able to get it right away. I know if it was me and I needed to talk to somebody right away, I don't want to have to wait 4 to 6 weeks to get into a provider because they're just not available. And I think that a lot of mental health needs, especially today, may not be met in a traditional EAP type model, right? We're starting to see some more disruptors in this space that are really changing the face of the game a little bit. So that's how we kind of see some of our employers looking as well. Certainly, management training, right? Being able to identify when you have somebody on your team or one of your employees that is going through some sort of mental health issue or some substance abuse issues. And I think it starts there as well. So not only having those benefits and those that support and the resources available from a corporate level, but then training your managers to know when something is occurring.
Absolutely, and that's really interesting, actually, because from what we've heard as well from speaking to some employers, that there's that common theme there of the APs having quite a low utilization. I think the average utilization something's like as low as like 3% for EAPs, and then you have the inpatient services, which can be very expensive, often out of state, out of network, and cost extortionate, like medical bills for some of these employers.